autism. We're going to talk a little bit about this with Dr. Aida Khanum. She's a Pediatric Pod, Concierge Pediatrics. She is joining us now live to talk about this. Dr. Khanum, thank you so much for joining us. Tell us a little bit about some of the issues that parents are facing right now trying to deal with getting their children diagnosed and start this process.
Good morning, and thank you for having me. So, in the Houston area, our goal really is to try and get these children diagnosed earlier because we know early interventions help. The sooner, the better. But in the Houston area, there's, typically in the large organizations, there's somewhere between a year to a year and a half wait list to try and get, because there are just a limited number of places that will test your child, and especially places that will use your insurance. So at our practice, we can get our kids in within a week or two. The goal really is to try and get a formalized diagnosis. The one that I do here at my practice is the ADOS2. And the goal really is to try and help those children get the therapies and treatments that they need to thrive and to help the families.
We mentioned early intervention is something that is very important. Why is it so important to get involved in this earlier rather than waiting until I'm assuming early means what, the age of 2, 3, 4, something like that, before they get to school?
That's right. Yes, so early intervention. So they found that if a child gets therapies before the age of 5 or 6, the outcomes are better. Therapies can be anything from behavior therapies, there's relationship development interventions, speech therapy, occupational therapy. There's a whole bunch of different therapies that are out there and available. The goal really is to kind of take each individual child and help them thrive. And so there's different aspects that you're looking at. We're trying to help with their speech. We're trying to help with their social interactions. We're trying to diminish any kind of negative behaviors that some of the children may have. We're trying to build relationships. We're trying to help them become independent. And that's the goal. So just like anything, when you start things earlier, the outcomes are better because, as you get older, you kind of get more fixated on certain behaviors and it's harder to break the patterns.
And when should a parent consider the idea of getting evaluations for their kids?
So typically when your child goes for the 18-month and 2-year checkup at the pediatrician's office, they will do a screening. That is routine. The American Academy of Pediatrics recommends it. It's called an MCHAT. That is a screening tool. Parents will complete a questionnaire, and then, the pediatrician reviews that. And if there are red flags, you usually go back and talk a little more in detail with the parent. Often parents kind of are already concerned if a child is speech delayed, they're not making good eye contact, they're not interacting with their peers, they have certain repetitive or restrictive behaviors, they will then often bring that up to the pediatrician as well. And as soon as things like that happen, the first things we want to do is we kind of recommend getting a hearing evaluation, get a speech evaluation. And if things are more significant, then we want to get them evaluated with the ADOS2 or a formalized autism evaluation, which is a formalized test. And it's about a 6-hour process from the pediatrician or the physician's perspective.
The other thing we talked about was self-diagnosis, sort of a trend on TikTok. Tell me a little bit about what's going on with that and why it's not necessarily the right way for people to go about looking at this.
Right. So, we've kind of seen, what happens is there are certain traits that parents will see and then they're like, oh, I think my child has autism. And most parents, there's a lot of misinformation online. And, the ones that trend higher are the ones that are actually incorrect information. And so what happens then is you're kind of following something that is incorrect and then you kind of hold on to that incorrect information. When you actually go and reach out to your physician, it's harder for the physician to kind of correct the information. So I think really, if you're worried or something's not right or you're concerned, bring it up to a professional like your pediatrician, and then hopefully they can send you on to try and get the evaluation done. And at our practice, we can get them in about a week or 2.
And there are a lot of services available for children that are diagnosed with autism, but you have to have a professional diagnosis. It's not just something you can just show up and say, oh, I think my son has this, or oh, I think I might have had this, or whatever. You need a doctor to weigh in on this, right?
Right. So actually, the reason you need a formalized evaluation is because these therapies are expensive, and for expensive therapy, we want to try and see if your insurance can cover it. So for insurance to be agreeable to covering a lot of these therapies, they actually want a formalized diagnosis, and I think it's the better way to do, because then you really know, is your child on the spectrum or not? And it is a spectrum. It's like a whole variety of different presentations, and I talk to my families all the time about how each child is different. It's not cookie cutter. Certain things work for certain children, certain things work for other children, and the outcomes will be different. And it's hard to tell, but again, early interventions are key.
Yeah, and just one more time, why is it taking sometimes months and months to get to see a doctor?
Because there's just not that many people doing it. There's only a limited number of places. So these evaluations take a very long time. There's very limited number of places that will do it taking insurance. So there's wait lists, and we have 1 in 36 kids being diagnosed on the spectrum. So just imagine that's your demand and supply don't match, and so that's one of the reasons why I started offering that at my practice.
Great, and you're with Pediatric Pod, Concierge Pediatrics, Dr. Aida Khanum. Thank you so much for joining us this morning. We appreciate all that information, and again, thanks for joining us here on the 9 a.m. News.